Hello and welcome to the web series ZeroPM Pieces. In the ZeroPM Pieces, the researchers in the project will tell you about one piece of the ZeroPM puzzle that they're working on. So without further ado, here comes a ZeroPM piece.
Yeah, it's nice to be here. Thanks for the invitation. I'm going to talk about mental models, and this is teamwork, so it's Elise and Matt who've joined in. Specifically, the sort of broader title for my talk is Risk Perceptions, Decision-Making and Behavior Related to PFAS, and that encaptures what we do in the social and behavioral sciences. And so it's a little bit of a tutorial, no, not a tutorial, but an overview of what we can do. In terms of content of the talk, I'll go through it fairly quickly. You can ask questions afterwards, but this is what I want to talk about, the social data gap, mental models as an approach. And then I want to show some preliminary results from two studies. Finally, talk a little bit about the tricky concept of essential use, which I also find fascinating. And I think there's a lot of work that could be done, and then present some conclusions. So first of all, we think there's a social data gap. We have a lot of data about PFAS, where you find it, where it's used, etc. And this is why this project exists, about evidence for environmental and health risks of PFAS. So that's sort of established already, but we lack social data. We don't really know what people understand about the risk, what they're concerned about, and whether they're willing to take action or support action, like regulatory action, policies, etc. regarding PFAS. And this is important because it tells us something about general awareness. So it's a descriptive task. We can also look at which factors are associated, are connected to potential concerns. So it's very descriptive. First of all, establish what people think. Then we can start thinking about communication. So knowing about people's understanding and factors such as values, such as motives, help us tailor communications to specific groups. And that could be to raise awareness, to encourage action, etc., etc. That's a communication task. And then finally, that also helps with other actions that you might want to do. You might want to encourage people to avoid certain products, but you might also want them to support policy action. You don't want them to be up in arms when something is banned. And that also helps this translation into interventions and into acceptable interventions. So that's just broadly where we think social data can help. And that should be based, obviously, perhaps on best practice social research principles. And I wanted to put this link in. We wrote a paper a few years ago in the context of microplastics, but it's perfectly exchangeable, actually. You can put chemicals in there, you can put other environmental risks. And in this paper, published in Analytical Methods, we summarize what social and behavioral research methods can do. So how can we use this in this context of environmental hazards, environmental risks? We put 10 sort of conclusions in. I'm not going to read through all of them, just to say for us, coming from this discipline, it's fairly basic, but it's perhaps nice to have them all in one place. So human perception and behavior can be subject to systematic and rigorous scientific study. That's a really key statement we wanted to make. We use theory-based hypothesis testing. We think carefully about measurement. We think about statistical analysis. There are different methods in which you can do this, very qualitative, what we would call quantitative. It's not quantitative in the natural science sense, but it's still quantitative in that it gives us some scores, some numbers to analyze. And there are different ways, different things you can do for different research questions. Maybe just the other point to make is number 6. There are definitely limitations and challenges that are unique to research with people. You know, people think too much, they try to guess what you're asking, and you have to be quite careful in constructing questions, constructing tools. Ideally, look at data from different sources using different methods. If they are consistent, that's a good thing. That gives you confidence in your findings. So that's just as a general point. Now, our approach in this project is about mental models, and I wanted to quickly run through what mental models are, what we think they provide. So it's basically what's in your head when you think about, in this case, PFAS. It's the understanding of benefits and risk as a belief network, so they all hang together. That's the mental model. And it's typically a mix, even an expert, not everything is necessarily evidence-based, reflects a mix of factual knowledge, some assumptions that could be erroneous, some value judgments, and some uncertainty. And uncertainty is a key factor here as well. What happens when you use a mental model in research? You go through various steps. You usually start with fairly qualitative work where you talk to some experts and get their understanding of the situation. You complement that by literature reviews. Then you go to the general public, to non-experts. You do some more in-depth interviews to get a sense of what they're thinking. Then, of course, you've got two sources of data. You can compare them. You can look at the commonalities and the inconsistencies, identify some conflicts perhaps. And then step 4, which is really important, is you develop a large-scale survey around these issues that you found in the first steps. And this insight can help inform decision-making. You can perhaps develop new communications. You can test labeling for products, etc., etc. So there's these 5 steps. They can focus on a specific environmental hazard system of causes and consequences, or also on potential solutions such as essential use. So it's very flexible, this framework. You can use it in different ways. And you can also use it in its entirety, step 1 to 5, or you can pick elements. It's fine to use it in different ways. So that's as much as I wanted to say about the sort of general approach we're taking. Now, in the research we've started, I said there, it's preliminary at this stage, really happy for feedback. I'm really happy to hear your thoughts on it. But basically, we started by co-selecting with some of you 20 everyday items that may or may not have PFAS. So this is the list of items. If you scan through them, you'll recognize many that have been discussed in the project meetings. There are also 2 which we've put in as sort of foils because we think there's no PFAS in them. That's the mop in the top row and metal cutlery. So these 20 items form the basis of a lot of our initial exploration here. And we ran 2 studies. Well, they're sort of still ongoing, especially study 2, an online survey where we now have 29 experts and 53 non-experts, but it's relatively easy to collect data because it's online. And here we asked them a range of questions. I'll go through them in a minute. And study 2 is interviews. So this in-depth element where we talk to experts and non-experts to derive models, mental models. So we're combining here some quantitative and some qualitative data. So jumping to study 1, this is what it looked like as an example at the bottom screenshot that Elise has made. There were different questions. We asked people, do you think this item contains PFAS at sale in the EU? That's our focus. So they said yes or no. When they said no, we skipped forward to essential. How essential do you think this product is? Because the other questions didn't make sense. If they said yes, I think it does contain PFAS. We asked what the percentage of the products was that contain PFAS and how easy they thought it was to replace PFAS. So we're asking this the expert and the non-experts. Of course, it's difficult to know the answer for sure, but we're asking them to give us their understanding, their view. And the same for question 2, how acceptable is it for these products to contain PFAS? Quick summary of some of the key results here. For the percent containing PFAS, we didn't have differences between experts and non-experts. So they sort of agreed. For the ease of replacement, experts generally reported greater ease of switching to alternatives than did non-experts. For PFAS acceptability, at the bottom left, we found experts reported lower acceptability of PFAS than non-experts. Something to come back to, but there seems to be something where non-experts tell us they think things would be regulated if they were so dangerous. So there's a trust in the system, in the regulation. And then finally, the essentiality of the items. Overall, the general level, there was no difference. But this is summarizing across all items. And of course, it's interesting also to look at specific items. So I'm just going to show this for the essentiality of items where experts and non-experts differed in their ratings. So this is the items listed at the bottom. The biggest differences you find on the right-hand side, where you can see that the experts thought these things were less essential, and they comprise non-stick pans, metal cutlery, car shampoo, flat screen TV, etc. So here we had some differences where, experts and non-experts don't agree. We can do that for the other items as well, but time-wise that won't fit today. The other thing we did in study 1 was we tried to understand how similar in structure, so in underlying thinking, the items were. And again, we did this for experts and non-experts. And we found this was quite complicated. So this is an exploratory factor analysis using principal components, essentially. Don't ask me any more detail on the stats. But basically, it's telling us for the experts, this is problematic. It doesn't really form a factor structure. And when we run the model, it tells us, please try something else. So it doesn't converge well. It doesn't tell us it's a good model. We think this could be because experts in general told us these things are not very acceptable and they didn't distinguish very much, which is, of course, a problem when there's reduced variance. So on the left-hand side, that's the expert model. We think there's probably a floor effect. For the non-experts, it's more interesting in a sense because there's a split between items, more or less a split between items that come into direct contact with the skin, with the eyes, etc., and those that don't. So that's really interesting because it helps us understand how people construe this whole universe of items and where we can start either prioritizing items or start regulation. So for the non-experts, that was clearly an important distinction to make. Things like makeup, period products, face masks, clustered together here, other things, car shampoo, flat screen TV, ski, snowboard, wax, were a bit more separate, a bit more remote from your own body. The second part, the second study was done in interviews, but not just interviews where people talk. We also gave them a task to complete. And this task was again based around the 20 items, and it was a sorting task where we asked them to sort these items 4 times. We did this first in the physical sense, so we had little cards. I'll show you what that looks like. And then we also replicated this online. So now we have an option to do it online. And we asked them to sort these in terms of personal versus societal essentiality. So 2 tasks, first personal essentiality, then societal essentiality, in terms of which contains chemicals in the broadest understanding. And we already heard from the experts, asking about chemicals is not so sensible. The experts say there's chemicals everywhere, but for the non-experts, that still made sense. And then we asked them to sort them. If they contain chemicals, do they also contain PFAS? What did they think? And along these sorting tasks, we recorded data, recording their understanding, their decision making. So it gives us a really rich data set on what people do. So here's some examples about the sorting data for the question, which of these items contain PFAS? Both non-experts, and this might be a little bit small on your screen, but you've got on the left-hand side probably contains PFAS, things like non-stick pan, rainproof jacket, mobile phone. Not sure in the middle, fire extinguishers, face masks, and these are probably don't contain PFAS. Flat screen TV and eye drops. And very similar here, although you can see people also vary in where they put things. So this is just a qualitative way of understanding how people categorize these items, and it gives us insight into the decision processes. So on what basis do they categorize them? Another analysis we did on this was on the top 5 most essential items, and here we're contrasting the experts at the top, non-experts at the bottom. Items are color-coded to make it a little bit easier. Maybe just to point out some mobile phones, 3 out of 4 experts here told us they are amongst the most essential items, and the non-experts agreed. And we can look more into these items, just aware of time, so I'll carry on. A couple of examples of the sort of thing we get from the interviews. So here are female expert and a male non-expert. So if we just look at the green bit, toothpaste, they agree on, yeah, it's really necessary, that's needed as an item. We're not yet talking about the function of PFAS in it. With the cars, there was a difference. The female expert said, I don't really care about cars. The male expert sort of started thinking about what is it for? Is it to clean the screen, etc.? So this is what I mean, it gives us a lot of detailed insight. And then another example here, these are both non-experts. This lady on the left talks about a non-stick pan she doesn't like to use anymore because her boyfriend once told her it had this toxic chemical in it. Then she says, I still sometimes use it, but not always. So she's tried to reduce her use. And that's just indicates how this perspective of personal use is really important. That's how people make sense of these things. The other example here is about refrigeration. The thing to point out here is that for some people, they can't afford to always buy fresh stuff or buy non-frozen stuff, and it might become an issue of equity and fairness. Final example from the interviews, and I'm speeding up probably, we also tried to find out about the pathways. What did people think? How does PFAS end up in humans, so human health effects? How does it end up in animals, the environment? And this was a drawing task. And if I just give you an expert example, these are sort of characteristic for the things we got. This is a fairly sophisticated model. So you've got the recycling plastic here. There might be some exposure during use, but the key thing is the indirect exposure. So if it ends up in landfill, it goes into waterways. If you clean it, it might degrade and release the chemical, etc. Contrast that with a non-expert mental model. Again, it only talks about the direct impact when you use it. And that's not surprising, but it just indicates this different and where we can start our communications. Often Elise was doing the interviews, she was doing some prompting, so trying to get them to think about other pathways, and it wasn't really coming forth. And the final picture here is just to show what we're trying to do with the mental models is put together not just the individual models, but abstract from those models the overall pathways. So we have a consensus. How does this happen? Where do things add up? This is just a mock-up. It's not really based on the data yet. The final point I wanted to make was a bit more about the essential use concept. I think it's tricky. I think it's fascinating. I think it's extremely useful. Obviously, Ian and his colleagues have worked on essential use a lot. They have come up with these two definitions. But the tricky bit, in my view, is that it's not clear what essential means to different people. So different people have different needs, different stakeholders have different needs, and we need to really understand where those are and ideally try and find consensus. How do we define essential use? There is a top-down approach where someone just decides, an expert probably, but that might not be received so well from the bottom up. And we've done a bit of research around it, and one thing we're quite interested in is other approaches where you define essentiality or essential use or minimum standards. And there's an example, minimum living standards, which is used, for example, in the Global South. It's used in aid context to define what people really need. So it's really, really basic. It's sort of shelter, food, safety. But, and again, the picture is probably a little bit small, but there are also higher levels of social well-being. So you might need something to connect to others. You might need something for your self-esteem. And then it becomes a lot more complicated. But there's an approach whereby these minimal living standards or decent living standards have been established via participatory methods, different methods. And I think that's something we can look at and compare and see what we can use for this concept of essential use. Now, I need to finish really, but I just wanted to point out when you look at the decent living standards, there are two examples already that fit. Mobile phones have been defined as necessary for decent living and cold storage as well. So I think there are some similarities, some things we can build on. Next steps, we obviously want to aim for the wide-scale survey in the near future, in the next few months. Here's a suggestion focusing on 3 countries, 1,000 people per country. We've costed for this in the proposal. And then following that, we can also start thinking about communications, maybe different labeling designs, different messaging. Very quick summary. So identifying social understanding is important, helps us to predict the route to take in order to remove or reduce PFAS, which is essential for the goals of the project. Also allows us to identify the obstacles. Will there be consumer backlash? How do we overcome this? What's the communication we? And to me, a really big question is how should we define and implement principles of essentiality as a process to regulate PFAS? Put this quote in because sometimes I hear this view that it needs to be top down. We have to decide what's dangerous, what's not dangerous, and then implement it. And I don't think it's that simple. I think it's really, as it comes to societal risks and societal benefits, we need to integrate the two. And a big, big thank you to Elise, who's helped put together these slides and who knows a lot more detail than I do, and to Matt as well. And obviously to ZeroPM for allowing us to do this fascinating work. Thanks.
ZeroPM, Zero Pollution of Persistent and Mobile Substances. This project has received funding from the European Union's Horizon 2020 Research and Innovation Programme under Grant Agreement number 101036756.